Hi, my name is Bob Spielman, and I've been paralyzed since 1991. I am a T5, T6 paraplegic. In 1993, after developing an abscess in my buttock, I had to have flap surgery. In order to maintain my active and independent lifestyle, I started to search for a device that would allow me to maintain the flexibility and independence I needed while allowing me to safely transfer in and out of my wheelchair every day. Luckily, I found the BeasyTrans, and I've been an avid user since. It has been well worth my time and effort to learn how to use it. Regularly, I transfer from my wheelchair, my bed, my shower chair, the car, and even onto my favorite sofa, where I sometimes will read the newspaper with my wife. It has allowed me to maintain my independence of lifestyle while ensuring the safety of all my transfers. The reason why is simple. It is the system that slides, and it is the system that bears the friction, not your body. In summary, I would urge anyone who could possibly benefit from the use of this product to give it a try. You'll be happy you did.
The BeasyTrans is more than a new product. It is a whole new patient transfer technology. Most importantly, it works. We're extremely proud of it. As with most medical products, there's a question of technique, getting familiar with it, giving yourself a chance to be comfortable working with it. There are a few fundamentals in working with the Beasy that are very important. As we demonstrate the many and varied uses of these revolutionary products, we would ask you to keep in mind that in every instance, care should be taken to arrange the shortest, and we must emphasize the most level transfer possible. In some circumstances, when a slight disparity in the height of the transfer surfaces exists, even when you have employed the adjustment techniques we will show you in this video, you may find that the 40-inch length of the BeasyTrans Easy Transfer system helps to minimize the disparity. As we go through the next few minutes together, let's keep these basic fundamentals in mind. The key to any transfer is giving yourself maximum room to work with and minimum obstacles. Remove the arm and foot rest closest to the transfer surface and swing away the other foot rest. A final but critically important tip is to make sure the wheelchair is locked in place during all transfers. Next, use all means at your disposal to make the transfer as level as possible. If a bed which can be raised or lowered is involved, please use that feature to your advantage. If a slight difference in height still remains, a towel or cushion can be used to raise the appropriate surface a few more inches. If you need a second cushion to achieve this, by all means use it. Making the transfer level is very important. Once the transfer is made as level as possible, you'll want to look at the angle at which the chair is placed. You may want to make a dry run, making sure that the seat will not contact a wheelchair wheel or anything else while the patient is on it. You should move the patient to their final position in one easy motion. The proper chair angle will also help you avoid obstacles. Use a transfer belt on the patient's hips for increased control. The next step is to place the seat under the patient's upper thigh. It is very important that the lead edge of the seat remain exposed. Many caregivers are accustomed to grabbing patients under the arms in order to lift or move them. In most cases, they were taught to do this. and have, over the years, formed a habit of doing it this way. To say it again, it is against the rules to lift. In fact, the Beasy won't work if you lift. Please think of your back. Leave the patient's weight on the seat. No lifting. We generally recommend that we use the same number of caregivers when first using the Beasy. After everyone is accustomed to the Beasy, including the patient, we can usually reduce the number of caregivers to one. Frankly, there is so much good at stake, we must be a little patient with ourselves and move forward gradually. The product itself is not complicated. The challenge arises from the condition of each patient, and we know every one of them is different. Place the seat under the patient by lifting the patient's lead leg over the other leg. Ask the patient, or help him or her, to lean as far as possible to the side opposite the transfer, lifting the buttocks as much as we can to make room for the Beasy seat. You will find at this stage of the process that most patients are anxious to help to the extent each of them is able to help. This team spirit should be encouraged throughout the process. Caregiver then grasps the seat so that it cannot move. Note that the patient is seated slightly to the rear of the seat. As stated before, this is important for maximizing the ease of the transfer. Move closer and place your arms around the lower part of the trunk and pull the patient closer to you. Give it a little bit of a hug. Now, we run into another one of those small but most important details we must watch. Be sure you grasp the patient at the lower part of the body with your arms around them, taking hold of the gait belt. To say it again, it is against the rules to lift. Finally, we have the need to remove the system from under the patient. A good rule of thumb is simply to be as gentle as possible. A good technique is to gently rotate the seat. One thing we do know is that being toward the back or trailing edge of the seat distributes the weight in a way which contributes to a smoother, easier transfer. That makes the Beasy particularly helpful for transferring oversized patients. In fact, the larger patients, you may want to put part of the buttocks behind the seat and lift them a little. We affectionately call this one a one-bun transfer. Don't worry about the weight. The Beasy can handle it. And as you know, our larger patients must be transferred too. The Beasy is designed to work in a number of specialized circumstances, such as when the wheelchair arms are not removable, or when you wish to transfer in or out of an automobile, or when the patient begins in the supine position, and when you wish to use the Beasy to boost the patient in bed. In this segment, we'll explore those specialized transfers. With some wheelchairs, it is not possible to remove the arm. One such technique is to approach the patient in a more head-on attitude than you would if the arms were removable. You can further assist the patient by lifting both legs and placing the system directly underneath him or her. Then, pull the patient forward in the chair until clear of the arms. Then use the BeasyTrans rotating seat to turn the patient to the proper angle for the transfer. When transferring a patient into a wheelchair with arms that do not detach, you may have to approach the chair with the user almost backwards, then slowly turn him into position. A common question is, what about the patient in the supine position? The answer is, the Beasy works fine if you follow this procedure. Roll the supine patient on his side away from the direction of the transfer. Place the Beasy on the approximate space vacated by his buttocks or the upper thigh. Roll the patient onto his or her back with their buttocks resting on the seat. Assist the patient to a seated position and proceed with the transfer. Both the BeasyTrans and BeasyTrans Easy Transfer system are ideal for the difficult supine to supine transfers, which must be accomplished with regularity in the institutional and the home care venues. Roll the patient onto the system, grasp and draw the patient to the bed or gurney. You will be surprised at the ease at which this difficult transfer is accomplished using the Beasy system. Incidentally, the same technique can help with some patients' ongoing need to be repositioned or boosted up in the bed. Using the seat placement technique shown for the patient in a supine position, lay the BeasyTrans vertically under the patient. Make sure the seat is in the middle of the system. Then gently glide the patient higher in bed. One of the most exciting applications of the BeasyTrans is the transfer into and out of the automobile. The convenience and portability of the Beasy has returned the gift of automobile access to hundreds of users. In some cases, this has even meant a return to life at home and with outpatient treatment rather than being institutionalized. First, open the car door fully. If you're placing the patient in the front seat, move the seat as far to the rear as possible, giving yourself maximum room to maneuver. Vice versa, if you're placing the patient in the rear seat. Plan the placement of the wheelchair so it is at the proper angle and as close as possible to the transfer surface. Please note that an automobile with its door handles, dashboard, and abrupt angles will increase potential for coming in contact with the seat, possibly impeding the transfer. One other tip. There are some surfaces on which the base of the system may tend to slide. Most commonly, they are hard plastics, or nylon, or silk surfaces. A simple solution is to put some type of surface under the end of the system. A towel or other non-skid material will usually suffice. I'd like to leave you with the most important Beasy transfer tip of all. Practice. Anyone who has ever helped transfer a person of limited mobility on a regular basis will tell you that a good combination of patience and technique is needed. The BeasyTrans Easy Transfer System, as stated before, represents nothing less than a whole new technology for patient transfer. Give some time to the Beasy. Get to know her. I promise you, you'll be glad you did. When you advance to the point that you no longer need the BeasyTrans Easy Transfer System, we will be as happy as you are. We hope you elect at that time to give it to someone else who needs it. Thank you for watching.